We recommend bracing for scoliosis when we see children with curves that are beginning to be a problem, but not really severe, say about 20 degrees, which is a very mild curve, and kids that are still growing. So that bracing works during the rapid growing period of adolescence. The ages are around 11, sometimes a little earlier to 13 or 14. Obviously, people mature at different ages, so someone that matures early would be braced younger, and someone that matures very late would be braced when they're a bit older. There are several different types of scoliosis braces. The current one we use is called a TLSO, and it's custom made for each patient. So the person making the brace will do measurements and computer scans of the person's size and shape, and then the brace is custom made from those measurements that are done when the child comes in to see him. The recommended times vary between different treatment centers. 16 hours a day is one recommendation that I use. Some people will try to get more hours a day, 18 hours a day, something like that. We now have ways of telling if the person's wearing their brace. And we have a little sensor in the brace that is sensitive to temperature. So when the person puts the brace on, the temperature comes up and the little sensor says now she's wearing her brace. And that little sensor in there can record this over a long period of time. So when you come back to see us, we put that in the computer and it says, I've been wearing it good, but didn't wear it very well that day, but we're wearing it well here, and gives us a sort of sum total of the hours that the person's been wearing the brace. And that's very helpful. That way we know what's going on. We can share that with the patient and encourage them to work as hard as they can to make it happen, and help them in every way we can. So it depends on when you start. If you start very young, you're going to have more time in the brace. If you start kind of midway along your maturing style, you'll be in the brace maybe a year. Generally, a year is the shortest time someone's in a brace, sometimes a year and a half, 2 years. Wearing the brace works most of the time to prevent progression to need a surgery. The times that it works are when we start early with smaller curves and people that are still growing. The times that it's less successful is that the curve has already gotten fairly large before we start, if the person is close to ending their growth, and in that situation the braces aren't effective. And sometimes people are very faithful with wearing the brace and the curve progresses anyway, and we really don't know exactly why that happens, but we would say most of the time the brace is going to be effective to prevent the person from progressing to needing a surgery. What you want them to understand is the purpose of the brace. Why am I wearing this? And to understand that when they don't wear it and the curve gets worse, it really changes things in a way that's, not beneficial to them. They're going to perhaps have a surgery and perhaps have more residual curvature than they would have had they wore the brace. We understand that it's difficult, but we try to help kids understand that there's a reason for it, that it's not forever. Something like wearing braces for your teeth, it's going to do you some good in the long run, but you don't like it while it's going on. We certainly want kids to continue all their activities, their sports. They're not going to have to quit playing volleyball or whatever sport they're doing. Their life will continue, and this isn't the end of the world. And as a teenager, the end of the world comes frequently, and you want to help them understand that this isn't it. Lots of other kids are doing it. They're not the only one that's ever had to do this, and no reason to become too upset about it, but to be proud of themselves for doing it and work hard at it and consider it just one of the little bumps in the road.